Hello, I'm Dr. Bang Jisung, the hair doctor who protects your hair. It's a pleasure to be here. Firstly, any surgery, by its very nature, involves creating a form of stimulus to the body. It causes a wound. As you might know, when your body is wounded, you experience what's called acute inflammation, involving bleeding, redness, swelling, and pain, right? Since most hair transplant surgery is done on the head, the swelling tends to travel down your face. Sometimes swelling can begin right from the start due to the surgical treatment or procedure itself. In other cases, swelling might not appear initially, but then show up on the second or third day. This occurs when an inflammatory response accumulates internally, eventually intensifying sharply at some point. The real issue is that swelling can vary greatly among individuals. You'll understand, some individuals are fine after eating ramen and sleeping, while others swell up. Some people find their eyes or face get puffy, even with a little fatigue. The degree of swelling truly varies immensely from one individual to another. Consequently, following the procedure, we generally advise patients to apply a cold compress or an ice pack to their forehead area frequently during the first 2 days. Furthermore, we also prescribe medications specifically designed to reduce this swelling. However, slight swelling can still occur in some cases, and as you've asked, a sudden significant increase in swelling is quite an unusual and peculiar phenomenon. However, typically, if patients retake medication and apply cold compresses diligently, the swelling will be absorbed. A bigger problem is that severe swelling can lead to a bruise. That's actually a much greater concern for me. What happens is, when swelling occurs, the capillaries in that area can rupture, causing a noticeable bluish bruise to form. For women, it might not be a huge issue since they can use makeup to cover it. But for men, if there's facial swelling and bruising, it immediately becomes obvious that they've had surgery. That seems to be a significant concern for many, so we always advise you to try and reduce any swelling as quickly as possible, and we do assist our patients a great deal in that regard as well, providing extensive care. Patients frequently express significant concern. Many cases involve them calling or visiting us directly because something white suddenly appears and accumulates in the transplant area, making it look dirty. They typically worry that it might be an infection or a festering wound. However, in most instances, what appears as a white buildup in the transplant area is actually sebum. Sebum, as I consistently explain, is secreted by a sebaceous gland. This gland is positioned within the hair follicle, located approximately 1/3 of the way up from the hair root, which lies deep within the skin. That's where the oiliness is secreted from. So simply put, when the transplant area is newly formed and starts producing sebum, I personally see that as a positive sign. It indicates good graft survival, stability, and a quick recovery process. However, from an external perspective, the surgical site might appear redder, and there might be some white discharge, making it look untidy, which can naturally cause concern. Therefore, in such instances, I advise them to shampoo a bit more intensely and for an extended period, and I reassure them that this is perfectly acceptable. Today, I've talked about some of the changes you might experience right after a hair transplant, a time when you might have a lot of concerns. There's no need to worry too much. If you have any questions, it's always a good idea to call the clinic where you had your surgery for a more detailed consultation. Thank you.